Hmm.
Meeting call to order.
Thank you, President. I request President Rotarian PHF Pratika Gupta to please confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated on our group, and I believe everyone has gone through them and does not have any objections or queries. Thereby, the minutes of the previous meeting stand confirmed.
Thank you so much. Today, we have a very important topic of hand transplantation. And we have a very eminent speaker with us today from Nanavati Max Super Speciality Hospital, Dr. Nilesh G. Satbhai. He is the Director, Plastic Reconstructive Microsurgery and Hand Transplantation from Nanavati. I request Dr. Rajiv Gupta to please give the brief introduction of our guest.
Thank you, Rotarian Ruby. Well, a very good evening to all of you. Dr. Nilesh G. Satbhai is a senior plastic, reconstructive and hand transplant surgeon at Nanavati Max Super Speciality Hospital, Mumbai. He is the director of plastic, reconstructive microsurgery and hand transplantation with over 18 years of clinical experience. Let me add here, he is the person who performed the double hand transplant in 2020 in Mumbai at Nanavati Hospital, the first surgeon to do so in India. Dr. Satbhai has completed his MS in general surgery and MCH in plastic surgery, along with advanced fellowships in hand surgery and microsurgery in India, the USA, the UK, and Japan. He is widely respected for his expertise in hand transplantation, reconstructive microsurgery, surgery for brachial plexus, and peripheral nerve surgery, and complex limb reconstructions. A recipient of several national and international awards, Dr. Satbhai is also a visiting professor and an active member of leading professional medical associations. He continues to play a key role in advanced hand transplantation and limb restoration in India. Now I invite Dr. Satbhai to give the talk on very important topic, hand transplantation.
Thank you, Dr. Rajiv Gupta, for the introduction. Before I hand over to Dr. Nilesh, I would like to take this opportunity and wish a very, very happy birthday to our three fellow Rotarians, Rotarian Hemrita Bandari ji, Rotarian Jaskaran ji, and Rotarian Shreya Goel on this very auspicious day.
Thank you so much, Shilpi.
Over to you, Dr. Nilesh Satbhai.
Fine. A very good evening to all of you. At the outset, I'm very thankful to be a part of this special meeting, and I would like to appreciate the efforts of your Rotary Club, which is devoted to create awareness for organ donation and organ transplants. And it is extremely good to collaborate with like-minded people because we are into this niche field of organ transplants and organ donation. And we know the reality of how there is a significant shortage of organs across the globe. I am actually, yeah. My actually my laptop had an issue and my presentation uh, is not currently opening. But in the meantime,
Can you just send that presentation to us right now, to me?
I'm just trying to figure it out.
So if you
Please
could share it over WhatsApp or mail, anything would be fine.
Because it is a heavier presentation, because it
Okay.
has a lot of photographs and videos, no? So,
Even mail is okay. Can I write to you the email ID?
in the chat box.
Just 1 minute.
yeah, so no, it's a problem with my laptop actually. It had some issue in the afternoon and it almost crashed actually. I got it restarted, but the presentations are not opening.
Hmm.
I'm just trying to figure out. In the meantime, I'll keep talking. As we know that there are different types of organ transplants happening. One is broadly we classify them as solid organ transplants, and the second category is a vascularized composite allotransplantation. So in solid organ transplants, we know the common transplants that happen are such as liver transplant or kidney transplant, or even heart and lung transplant. By VCA, the second category that I'm talking of, we it means that it is a vascularized composite allotransplant. What this means is that we are transplanting tissues, not organ in particular, and tissues could be composite tissues. So what that means again is that suppose a hand, it is composed of skin, bone, nerves, muscles, tendons, blood vessels. All these structures together give the hand a composite tissue. So this is classified as a composite tissue, and similarly, a face transplant, which has not yet happened in India, it could be an requirement in the future for patients who are acid attack victims. So in acid attack victims, sometimes the face is so severely damaged that it is not possible to do any sort of reconstruction for these faces. And as a result, the patients are living a severely compromised life. They are not able to face the society. They are not able to get jobs. They have social problems. They have mental, social, psychological problems due to their external and visible deformity, and they are living a severely compromised life. And as we know that we all always talk of you only live once. So this is our one time opportunity of making the most of our lives. And so everybody deserves to live a good quality life. And that is what is the main intention behind any organ transplant. So similarly, hand transplants or face transplant for that matter are not so-called life-saving transplants, but still they are essential transplants because they can restore the life of somebody who is suffering on a day-to-day basis. We cannot imagine a life without hands. So we are practically using our hands for every single activity. So we take our hand function often for granted. And when our hands are injured or we lose a finger or a hand completely, or some people unfortunately lose both their hands, that is when it is realized of how important it is to have all these structures intact and to be able to live a full and complete normal life. So these transplants, that is why they came into vogue. Any sort of vascularized composite allotransplants. Currently, face transplants have been performed only in the US and in France. India is preparing for a transplant, but naturally, as we face shortage of organs, there will be a challenge in getting a face donation as and when we get ready for a face transplant. Currently, we started with the same idea. Even for hand transplants, it was extremely challenging when we started way back in 2016, and initial few years were spent in creating awareness about organ donation, and That was the biggest challenge, and gradually the transplants started happening, and from a word of mouth, or in terms of the recipients, they are always searching for a solution. They are always looking for options. So it is easier to reach out or find a potential recipient, but it is extremely difficult to find a donor, because the biggest challenge is that people are not aware that such transplants are possible and such donations need to happen. So that is the biggest challenge for any VCA. So way back in 2016 when we started, there was extremely poor awareness about hand transplants, and people were not willing to come forward with hand donations. So as we kept talking about it, we created awareness about it. Gradually, we could execute our first transplants after a wait time of almost 4 years. And in 2020, we finally performed our first bilateral hand transplant right uh, during the COVID pandemic. So it was an extremely challenging situation of getting an organ from Chennai, getting it airlifted with the flight restrictions, with restrictions of personal movement, and
I think we lost the doctors.
span, so that
Yeah. Yeah, please go
There
ahead.
was a slight lag. There was a slight lag, sir, but it's
Please go ahead.
resumed now. We can hear you now.
okay. So the transplants have a tight timeline within which they should be completed, because the organ cannot survive or sustain without blood circulation for a very long time. So any transplant typically has ideally to be performed within 6 to 8 hours after the organ is retrieved. And that is the biggest challenge, that if a donation is happening at a remote place, then getting the organ, sometimes it is not possible to get it by a routine or a commercial flight. Then in that situation, we have to get it by a chartered flight, and that adds to the cost of the treatment, plus the duration of the surgery. A significant time is lost in the transit, and as a result, it becomes all the more crucial that these organs reach to us in time, and we are able to restore the circulation of these organs at as early as possible. Hmm, I'm trying to open the presentation. But yes, I'm sure is your club aware of hand transplants, or has somebody spoken about it?
Yeah, yes. Earlier, the doctor from Amrita Hospital, Faridabad,
Dr.
he
Mohit
has
Sharma.
he
Dr.
Okay,
has
Mohit Sharma.
spoken on that.
Mohit has spoken to you, right?
Yeah.
So, yes, so hand transplants can actually be extremely life-changing, because and a person who has lost both his limbs can practically perform just 15 to 20% of activities as compared to what a normal person would perform. Hence, restoring hands or restoring hand function is extremely important in order to give them a second chance in life. I'm so sorry about the glitch.
It happens.
Yeah, and it happened at a very wrong time.
Yeah.
I'll just try to. In the meantime, I would suggest that we can have some questions or some
Yes,
in
yes,
the chat,
okay.
so that we don't lose.
Thank you very much, Doctor, for giving your views on hand transplantation. Before I will open to the panel here, I have all our esteemed members. I have two questions, very quick questions.
Yes.
How expensive is this surgery?
Yes. So, because this surgery is a major or it is a time-consuming surgery, it takes close to 15 to 18 hours at times. and the patient has to remain in the hospital, or we have to monitor him for the post-op recovery. The ICU stays longer, and the average patient's hospital stay after a hand transplant is typically 3 to 4 weeks. They are on intensive care monitoring. They are on immunosuppressive medications. They are on strict ICU care. So all in all, it adds up to a significant cost, and this cost in the current day and time is close to 25 lakhs. So that is the average cost which is incurred for such patients, or for such surgeries. Also, we have to be performing multiple tests. The immunological tests are quite costly at present, and we have to monitor them on a regular basis. And they are on lifelong immunosuppression, so that is a recurring cost which they have to bear. So and that cost comes in today's day and time at least 10 to 15,000 rupees per month. That is a
Okay.
lifelong cost that we are looking at.
So total about 25 lakhs one has to pay to the hospital, which
Yes,
includes the surgery, includes the stay, everything. And then
yes,
the medication about 10 to 15,000 per month, correct?
yes, sir.
And
Yes.
this is not covered under the Ayushman Bharat
No, as of now, there is no provision
for the tissues.
for the tissues. The organs, there was an announcement that some organ transplants will be supported under the national scheme, and some funds will be allocated to it. And we hope that in future for hand transplants also,
Will
the
be
funds
there.
will be allocated.
Okay. And the second question is, you are talking about hand transplant. You being a plastic surgeon, what about leg?
Yes, so we get multiple queries for leg transplants, but the worldwide the situation is that there were three leg transplants performed till date in Spain, but unfortunately in one or two patients they had some systemic complications due to the medications, after which they stopped doing the leg transplants. But so currently, there's no country in the world which is doing leg transplants, mainly because, as I said in the initial phase, that these are not life-threatening conditions. So these transplants are not life-saving. So they are essentially to improve the quality of life. Unfortunately, there is no good prosthesis available for a hand. That is why a hand transplant is the only solution by which these patients can be rehabilitated. But for the leg, there are very good quality prostheses available, and people can live a very good quality life even with an prosthesis. So the cost benefit ratio, or the risk benefit ratio of a hand transplant and the leg transplant is quite different, and hence there is always a doubt of whether a leg transplant should be performed or not. Having said that, we do get several queries. We do get several patients who are facing difficulties, or who face significant challenges in their day-to-day life because of not having a leg. And in such special situations, sometimes with a proper informed consent, a leg transplant can be justifiable if it is the patient's strong desire.
Okay, but according to you, it is medically it can be done. There is no problem, but
Yes,
one has to be very careful about that.
it has to be done. There's no problem about it. But the patient selection has to be stringent, and the patient should be extremely aware, motivated, and understanding in terms of what he is venturing for.
Okay, thank you
Because
very much. Now I'm opening this to everyone, anyone who would like to ask the question. I can see the finger of प्रमोद महाजन जी. हाँ, महाजन जी अपना अनम्यूट करिए अपने को अनम्यूट करिए और प्रश्न पूछिए.
नमस्कार
महाजन,
सर जी.
हाँ,
नमस्कार. जैसे कि किडनी के लिए
yes.
ब्लड ग्रुप जरूरी रहता है, ऐसा अवयव के लिए ब्लड ग्रुप जरूरी रहता है.
यस, एब्सोल्युटली. तो जो ये टेस्टिंग जो की जाती है, ये बेसिकली डोनर और रेसिपिएंट की मैचिंग करने के लिए टेस्ट करनी होती है. तो ये टेस्ट में ये देखा जाता है कि डोनर और रेसिपिएंट में कितना अंतर है या उनकी बॉडी उस ऑर्गन के खिलाफ किस तरीके से रिएक्ट करेगी। तो ये देखने के लिए ये क्रॉस मैच टेस्ट और एचएलए या इम्यूनोलॉजी के जो भी टेस्ट है, ब्लड ग्रुप एक बेसिक टेस्ट है, बट इसके अलावा एचएलए टेस्टिंग होती है जो कि एकदम डिटेल में एनालिसिस होता है दोनों डोनर और रेसिपिएंट का। और फिर क्रॉस मैच टेस्ट के बेसिस पे ये डिसाइड किया जाता है कि वो ट्रांसप्लांट हो सकता है या नहीं, या क्या वो ट्रांसप्लांट करना सेफ है होगा कि नहीं। एंड अगर इम्यूनोलॉजी के हिसाब से अगर देखेंगे तो हैंड में स्किन कंपोनेंट काफ़ी ज़्यादा है। तो उस वजह से हैंड की इम्यूनोजेनिसिटी जो है वो बाकी सारे ऑर्गन्स से कई ज़्यादा है। तो इसीलिए ये टेस्ट का महत्व हैंड ट्रांसप्लांट में लिवर किडनी ट्रांसप्लांट से भी कई ज़्यादा है। और इम्यूनोजेनिसिटी ज़्यादा होने की वजह से बॉडी की जो रिएक्शन होती है इन ऑर्गन्स के खिलाफ वो भी थोड़ी स्ट्रांग होती है। इसीलिए जो मेडिकेशंस की ज़रूरत पड़ती है वो किडनी से भी स्ट्रॉन्गर मेडिकेशंस की ज़रूरत हैंड ट्रांसप्लांट में पड़ती है।
तो इससे इफेक्ट नहीं आता और ऑर्गन्स के ऊपर जब आप मेडिकेशन हैवी करवा रहे हैं?
यस, तो ये इसीलिए ये एक बहुत ही टाइट रोप सिचुएशन होती है, स्पेशली इन द फर्स्ट ईयर, क्योंकि पहले साल में रिजेक्शन एपिसोड्स होने के चांसेस सबसे ज़्यादा होते हैं। उसके लिए फर्स्ट ऑफ ऑल आपकी क्रॉस मैच टेस्टिंग स्ट्रॉन्ग होना ज़रूरी है, ताकि डोनर और रेसिपिएंट की मैक्सिमम मैचिंग अगर हो तो उनमें रिजेक्शन रिएक्शन होने के चांसेस कम हो, या रिजेक्शन रिएक्शंस जो होंगे वो माइल्ड फॉर्म में होंगे। तो ये बैलेंस रखना ज़रूरी होता है कि अगर रिजेक्शन हुआ है तो नेचुरली मेडिसिन का डोसेस हमको बढ़ाना ज़रूरी है, बट फिर उसकी वजह से जो साइड इफ़ेक्ट्स या कॉम्प्लिकेशंस होने के चांसेस है, उस हिसाब से फिर मेडिकेशंस को बैलेंस किया जाता है कि किस तरीके के साइड इफ़ेक्ट्स और कॉम्प्लिकेशंस दिख रहे हैं। उस हिसाब से उन मेडिसिन के डोसेस कम किए जाते हैं, दूसरे मेडिसिन के डोसेस बढ़ाए जाते हैं। तो वो थोड़ा सा टाइट्रेशन किया जाता है, क्योंकि हर एक की बॉडी, हर एक रेसिपिएंट की बॉडी अलग तरीके से रिएक्ट करती है। तो इसीलिए हर एक का रिस्पॉन्स अलग होता है, हर एक की रिक्वायरमेंट अलग होती है। तो ये बैलेंसिंग जो है फर्स्ट ईयर में ये काफ़ी टाइटली ऑब्जर्व करके ये करना पड़ता है, ताकि लॉन्ग टर्म में हमको कोई मेजर साइड इफेक्ट या कॉम्प्लिकेशंस ना हो।
Okay, thank you very much. Rotarian Rajesh Gurhani, please.
Yeah. Dr. Nilesh, you said only 3 cases have been tried in Spain.
Yes. Yes.
India, it has not been tried as of yet, but still you say it can be done. What could be the reason, why people have not tried it out?
नो, बिकॉज सी वी आर, ये एक लर्निंग कर्व की तरह होता है, या
Okay,
हर 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 कंट्री एक फेज से गुजरती है, राइट।
correct.
मेडिकल एडवांसेस भी उसी फेज में होते हैं, राइट। तो 10 साल पहले इंडिया की रिक्वायरमेंट्स या मेडिकल रिक्वायरमेंट्स कुछ अलग थी, इंडिया के फाइनेंशियल स्टेटस कुछ अलग थी, मेडिकल एडवांसेस कुछ अलग थे। उसके बेसिस पे जो चीज़ें ज़रूरी होंगी वो पहले की जाएंगी, उसके बाद में हम और चीज़ों पे ध्यान देंगे, ताकि
Okay.
हम बाकी चीज़ों को कैटर कर सकें। तो नेचुरली वो प्रायोरिटी वाइज वो सिलेक्शन अपने आप होता है, क्योंकि हैंड डिसेबिलिटीज ज़्यादा होते हैं, इसलिए
Is more important than the leg one. Yeah, get it. Thanks.
Okay,
Thank you.
thank you very much. Yes, please unmute yourself so that I can see and immediately point. Yes, Rotarian PHF, Dr. Rohan Monis, please.
Namaste, Nilesh. So this is Dr. Rohan here. So you mentioned about the immunogenicity of the skin when you do a hand transplant. Sir, and there are incidences where we talk about tissue transfer or skin transplant. Uh, is the story different there compared to a hand transplant when you talk about reducing the immunogenicity of a patient who is a receiver?
No, so you mean a skin donation?
Skin donations, when they do because tissue and organ donations, we talk about tissue donations. So there are tissues which are harvested and put on a burns patient primarily.
Right, right, right.
Yeah,
So
but that will be a different case, isn't it?
that is basically skin donation, right?
Yeah.
So what the skin banks are doing, they are harvesting skin from the donors, and they are processing it and storing it.
Yes, sir.
And whenever these are the primary use of this skin is in burn victims. So suppose somebody has an extensive burn, it is almost 60-70% of their body has wounds. So
Yes.
what that does is that leads to a lot of fluid losses, a lot of electrolyte losses, which makes the day-to-day maintenance of the patient extremely challenging, and it
Right.
keeps the patient unstable. So
Right.
what is done is that the cadaveric skin from the skin bank is taken, and
Yes.
skin is applied on these burn patients.
Yes.
So what that does is it provides a biological tissue cover for
Yes.
the wounds,
Yes.
and it reduces effectively the percentage of burn area.
Yes, sir.
But these patients are not on any immunosuppression, or there is no specific cross-match testing or anything being done for
Exactly.
these cases. So,
Exactly.
so this cadaveric skin is definitely going to be rejected.
Okay.
Okay. So,
Okay.
but that rejection will happen slowly. So that will
Slowly.
happen in 3 to 4 weeks. Till,
Got it. By the
till
time the new layer forms up.
that time, the patient is stabilized, and he's able to tolerate the injury in a better way.
Okay. Okay. Okay.
So
Thank you. Thank you,
it
sir.
is a temporary measure which is helping us in saving burn patients with high percentage of burns.
Right.
Okay, thank you very much, doctor, both the doctors. Now, yes, please unmute yourself. If you have any question, you can ask the question uh, so that we can have more knowledge about hand trans. Yes, I can see the Rotarian Sandeep Kulshrestha. Yes, please.
Very good evening to all of you. And first of all, I express my gratitude to Lyle Guru sir because he introduced me in this Rotarian family. Thank you, sir. And I'm coordinator and PGT biology in a CBSE school from Mathura. So now I came to know that there are so many, in Mathura, most of the people know that organ transplantation can be taken place of only hands or a piece of liver or only kidney. But now when Goyal sir visited to my school, then we came to know that skin part also can be transplanted. Now we came to know that lymph part also can be transplanted. So, sir, I think in small town like Mathura, Aligarh, Hathar, there is lack of awareness. So we must do some sort of to increase the awareness. This I feel. So you can suggest me what we can do at our part. So this awareness can be increased.
So
Anyway.
the biggest challenge that we have realized is that when we talk of hand donation at the last moment when the patient is already brain dead, it is a totally new thing for the family, and they are actually in a different mindset. They are going through a difficult time. But they are somehow they have heard of liver transplant, kidney transplant, eye donation, or skin donation, but hand donation is something which they have not heard at all. And plus the major challenge is that all the other organs, the transplants, the organs are all internal organs. They do not cause any external deformity to the body. But imagine in hand donation, we are actually cutting off the hands of the donor, and we are taking the hands. So that is causing a visible mutilation to the body, and it will have its own mental impact on the family to see your loved one in that disabled situation. So to prevent that, of course, we use a prosthetic limb. A prosthetic limb is attached to the donor body when such donations happen. But the idea is that the knowledge of all these transplants should be freely disseminated in the society to such an extent that everybody is aware beforehand that such surgeries are possible. They have made differences in the life of so many patients, and there is nothing bigger than seeing the hands of your loved one after his death on somebody else's body. So we have instances where you must have seen there was a very viral post of the Raksha Bandhan when one of our recipients, she went and tied Rakhi to the donor's brother. So imagine your own sister's hand tying Rakhi. So it has a huge emotional and psychological impact. So the challenge for a hand donation is also that it is an external organ, but the advantage is that you can actually see it, you can actually feel it, you can actually touch it, you can actually see the person living a better quality life. So the impact is both ways.
Okay, thank you very much. And I would like to add one thing for the what question he has asked and why these types of awareness is not there. I understand that the awareness is required, but these towns like he was mentioning Mathura, Aligarh, Hathras, Agra, etc., they don't have even a kidney transplant retrieval center, or forget the transplant center, even retrieval centers of organs. So that is a very big challenge, because if anyone declared first, no one can be declared brain death there because there is no brain death declaration committee. So if there will be a committee, there is no retrieval center, and nobody will take a person who is declared brain death to about 150 or 200 kilometers away to give the donation of organs and then bring back the body and for the cremation. So that no one is going to do. So first thing is the infrastructure, lack of infrastructure. But yes, in hand case, at least one can uh, promote it. But the problem, again, the same problem what you have raised, you have said that the challenge is how to convince a brain death
Yes.
person's family, because it is not easy that somebody will cut. Taking out the organs from internal side is easy, but to take out something which is visible, even the eye cornea, it's not visible because they are just taking the cornea out. They are not taking the full eye. So that is why it is. But yes, one has to create the more and more awareness. Thank you very much. Any other one wants to ask question, please unmute so that I can see, and I will immediately point out. Professor Saran, you would like to ask any question? Okay, Rotarian Mridul
Yes.
Saraswat. Yes,
Hello,
please.
sir. There is one question from my side that if a person going through the surgery of a hand transplant, for how much period he or she have to take the immunosuppressants therapy?
Yeah, so in all the transplants, the immunosuppression is always lifelong, because genetically no two persons are similar to each other. So the body will always have a genetic memory. So it will always know what is my own and what is not mine. So the hand which is transplanted will always remain different for the body throughout the lifetime. So immunosuppression is compulsory lifelong.
How much time, doctor, it will take to be normal with a hand transplant patient, that he or she will be doing the same activity which he or she would have done if with her hand or his hand?
Yes. So the yeah, so it depends on the level of the transplant. Suppose the transplant is happening closer to the wrist, then the recovery is much faster. Even the finger movements actually start immediately. The finer movements take some time. It could but it could return back in 3 to 4 months also. As we go higher up, as we go suppose below the elbow, then it could take almost 6 to 9 months for it to return. As we go above the elbow, it could take more than an year. As we have done some transplants almost at the shoulder level. In fact, we have the largest series. Unfortunately, I'm not able to show it to you. Maybe I will request for one more session sometime, so that I'm able to show my cases and show the experience that we have got, because we have got a certain some very unique experiences. We have the largest series of shoulder level transplants across the world, because of unique challenges in doing these transplants. Not many centers actually do shoulder level transplants because the timelines have to be even more crucial. Shoulder level transplants can take almost 1.5 year or more to get functional recovery. So the as we go higher up, the function deteriorates. Yeah, the quality of the function deteriorates, but something is always better than nothing. And these patients never really try to quantify their function in terms of finer movements or finer activities. They are just happy that they have hands. They are able to manage their day-to-day life. They are able to take care of themselves. They are able to take care of their personal hygiene on their own, because it is a huge embarrassment for adult patients to be dependent for their personal requirements on somebody else. So it is a huge impact on their self-respect. So whatever the function, ultimately, the amount of function that you can gain is based on how much effort the patient is putting on their physiotherapy.
Okay.
So we have some very excellent results also. We have some average results also. So it all depends on how much effort the patient has taken or how much intelligently he is trying to use those hands.
Okay, thank you very much. We have just received earlier. We have received, so I circulated that also. There was a press cutting in Navbharat Times. Hand transplant se jagi jindagi ki ummeed. The transplant which we have done in this year only.
Yes.
How is that patient? Is he still in your hospital?
He is still in the hospital. We are planning to discharge him on Tuesday, and
Okay,
he's done exceedingly well actually. So he's doing very fine. So
very good. Thank you very much. I can see Professor Saran is ready now with the question. Yes, Professor Dr. Sudhir Saran.
Thank you, Dr. Nilesh, for a very clear presentation. The point which is, in my mind is some people are born without limbs, hands are not there. Now, can they take advantage of this surgery?
yes.
And if that, how challenging is it for them to get the normal functions?
Yes. So I have it in my presentation actually that we have performed the first such transplant. It is Asia's first transplant for a congenital absence of hand. Because traditionally most of the transplant happen in patients who have lost their hands in accidents, but for somebody who is not having a hand since birth, there's no transplant which has happened in Asia. And even in worldwide, if you see, there is just one transplant which has happened in Austria, or no, sorry, Poland. Besides that, this is the second patient in the world and first in Asia to undergo a hand transplant for a congenital absence. The challenges here are that, so first of all, not every patient requires this transplant, because if you don't have a hand since birth, your brain is wired in such a way that you get extremely accustomed to use or work with just one hand, or you're able to do everything practically, sometimes even better than normal people. So most of these children are happy the way they are and they don't want anything. There will be a selective person who feels that they need a hand desperately, and that is how we did this transplant. The challenges, of course, are that the structures are extremely smaller sometimes, or they are underdeveloped. So the planning of this transplant has to be done very meticulously. So the way the bones have to be fixed, because the bones are also smaller in size, there is a mismatch in the size of the donor and the recipient. The blood vessels and the nerves are smaller. So we have to plan it really well. So if I'm able to show my case later, I will be able to explain that better. And of course, one more challenge is in their rehabilitation, because the brain is not aware of what it is to have both the hands. It is used to work in a certain manner, so it is extremely challenging to retrain or to unlearn what the way you were working all this time, and to learn it doing it in a new way. So we faced some special rehabilitation challenges for such patients, but
Okay,
yes.
thank you very much. Yes, Rotarian Ramnath Pradeep, please.
Yeah,
I can see the
Dr.
hand of
Abbas,
Rotarian Professor Dr. Lakshmi also, but after Rotarian Ramnath
yeah.
Pradeep, please. Yeah.
So, sir, there is any age factor to be considered for appropriate transplantation? Is there any appropriate age?
So
See, we have seen number of girl child, number of boy childs when they are born with one hand, and there are different area of that. In that case, if it is immediately taken care, or maybe 6 months down the line, or 2 months, 2 years down the line, or when they are grown up.
right. So as I mentioned that this is not a life-saving surgery. So only in life-threatening situations, the parents are legally allowed to give consent or to give approval for a major surgery. For non-life-threatening conditions, it is important to have the consent of the patient himself. So, uh, 18 has been decided, 18 years, which is the legal age to give consent, has been decided as the cutoff age for which a transplant should be performed. Though it is not mentioned in black and white, or though it is not mentioned anywhere rigidly, but what we try to assess is the understanding of that particular child, of how mature the child is. Does he understand the implications of taking day-to-day immunosuppression? Are they motivated enough to go through the rehabilitation process? Are they committed for the treatment? Or and do they feel the need to undergo a transplant due to their disability? So all these factors are the deciding points. So we have done a transplant even in a 16-year-old girl. She is our youngest recipient. In fact, the girl, she had lost her hand from the shoulder level. She was extremely clear about it, very mature, more mature than even an adult person, extremely understanding, and she was clear about what she wanted and what she is opting for. So that is the situation. On the higher side, roughly it can be done even till 60 years of age or so. There's no specific cutoff on the higher side.
So, Doctor,
But
what is the situation as of today in terms of artificial limbs?
Artificial
It is
limbs,
available. It is available with the full functionality, or it is available with the. And what are the problems there?
yes. So the basic problem is that the artificial limbs are not satisfactory. That is the whole reason or the basis on which hand transplants are performed, or the hand transplants are justified, because the artificial limbs do not give you adequate function. They do not have sensations. They cannot be used in water. They carry a certain amount of weight which is extremely uncomfortable to use on a day-to-day basis, and it has skin issues or other problems. And plus the cost is extremely high. For the best quality prosthesis or very advanced prosthesis, the current cost is 35 to 40 lakhs.
Oh,
And that also is not a permanent thing. You need to repair it or refurbish it every 2 3 years. So it is a recurring cost. So paying that much cost for an inferior quality of function is not really advisable, and that is why hand transplants are being performed.
okay, thank you very much.
less performed. Thank
Yeah,
you.
doctor, you have mentioned, because of what Dr. Ramnath Pradeep asked, a child of say 4 or 5 years, like for organ transplant, like kidney transplant, is taking place. Even liver transplant recently, one of our known person, for in 7 months of the child, the liver was transplanted. So my question to you is whether in the hand also this thing can be done, and for that whether you have a super specialty for the pediatric surgery, or the same like yours, your super specialty will work in that.
So naturally, in children, suppose children who lose their limbs, we perform their replantation surgeries, or we reattach those limbs. So it is not about the capability to do it. It is the question of whether the
Acceptability.
patient wants it or not.
No, but the for
Uh,
like kidney
for
or the
liver,
liver.
so for
Yeah.
liver transplant is a life-saving surgery. Without a
Okay.
liver, somebody would die.
Mhm.
So that is not the situation in hand.
Okay. Thank you very much, Professor Dr. Lakshmi. Are you there?
Yes, yes, I'm
Yes.
here.
Yeah,
Thank
yes.
you. Thank you for the opportunity. And actually, I lowered my hand because the question I wanted to ask was already covered. I was curious about how prosthetic limbs might be a substitute for hand transplant. But do you see the situation changing with advances in AI and sensors and haptics? Do you see that prosthetic limbs might be a substitute in the future, in the near future?
Yes, it could. We could have a breakthrough in the prosthetic technology. Most important would be sensory. I mean, the sense. If you are able to sense it, then it makes it more effective. Plus, if we are able to lighten the processes, that makes them more compliant with it. Uh, So you never know. There are certain situations in which we recommend them that you go for a prosthetic limb of however poor function it may provide, because they are reasonably well adapted. A single limb amputee, the disability is extremely low, I would say. Even with one hand, we are capable of performing almost yeah, 80 to 90% of all our activities. There are very select activities for which we actually need both our hands. So the decision making for a unilateral hand transplant is always more challenging. For a bilateral, you don't have a choice. The decision is quite clear and it is definitely justified. But for unilateral, it is the patient motivation and it is a patient demand that takes the priority.
Okay, thank you very much. Yes, anyone else wants to ask question, please unmute. If there is any other question left, which you feel the doctor should reply for. I can't, I'm not seeing anyone. Yes, I can see Rotarian. Yes, Astha Saxena. Yes, please.
Hello, good evening, everyone. Thank you so much, sir, for an insightful session. Sir, I'm a psycho-oncologist and we work with cancer patients. So, I have seen many patients who have gone through amputation due to sarcomas. So, in that situation, cancer patients face a severe psychological impact, that is phantom limb syndrome. And sometimes it is very difficult for them to accept it that they don't have a limb and still they feel the pain, and that the pain is too severe that they, and even after the medication also they won't feel relief. So in that situation, can a cancer patient is can they have a transplant?
So we need disease clearance, or we need complete cure uh,
Yes.
to go ahead with the transplant. So technically, yes. If there is more than a 2 year span which they are cancer free, a transplant can be considered.
Because in cancer there's always a risk, but
It's
again.
always the risk, and plus the immunosuppression is actually a double-edged sword. So it is theoretically immunosuppression is known to be a risk factor for mainly for infections, but also for some cancers.
Okay.
So whether it will reactivate a cancer is something which nobody can reply, because as of now we have not experienced any such complication in our patients. The reason why the leg transplants were stopped is because one of the patient who was on immunosuppression developed a CNS lymphoma. So that complication was not acceptable for a non-life-saving surgery, so to say, and that put that program at a halt.
Okay, thank you very much. I think now everyone has asked questions, so over to you, our Inspire Secretary, Rotarian Ruby Agrawal.
Yeah, thank you so much. And it was a very, very intensive and very detailed question and answer round that you have taken, Dr. Nilesh. And since there is no questions left, we would like to proceed with the vote of thanks. I request Rotarian Hemata Bandariji to please give the vote of thanks.
Thank you, Dr. Nilesh Satbhai, for sharing your profound expertise and inspiring clinical breakthroughs achieved at Nanavati Max. Your dedication to restoring both form and function truly highlights the life-changing impact of reconstructive microsurgery by giving the example of tying Rakhi to a brother. We are deeply grateful for the clarity you provided today with your wonderful presentation. May you continue to bring hope and a healthier future to countless individuals and families worldwide. I, Rotarian Hemlata Bandari, on behalf of the President and the Rotary Club of Organ Donation International, would like to express my sincere gratitude to all of you for attending and watching this informative and inspiring meeting live. Thank you once again.
Thank you very much, and I'm extremely sorry that I could not present as such, but I think we had a good discussion, and I would surely like to connect with all of you once again. Of course, with Dr. Mohit has spoken to you, so I'm sure you have seen the clinical outcomes, and I had certain unique things to show The one is the congenital hand transplant. Then we have the Asia's first bilateral shoulder level transplant. We have Asia's first partial hand transplant. So we have certain unique cases in our series, which I would have loved to show it to you. And if there's an opportunity, I will definitely like to do that.
Definitely, doctor. We will like to give the opportunity as soon as possible. I can see now Rotarian Deepan Shah. Rotarian Deepan Shah, are you there? Can you unmute yourself, because he's our tissue donation chair, and he's a skin retrieval, tissue retrieval expert from USA. At present, he is in Mumbai. Yes, Rotarian Deepan Shah, you'd like to say something?
Yes, Mr. Goel, thank you. Actually, about to raise my hand. Hello.
Yes. Please go ahead.
Yes, yeah. So actually, about you pick my mind, because I'm about to raise my hand, and definitely I have a question for Dr. Nilesh Bhai. The reason I'm actually went for walking here, the great question came in mind in the beginning of the meeting is what I understand. I work for J&J, Johnson & Johnson. I'm a department head for skin recovery specialist, and I'm affiliated with NG Sharing Network, one of the biggest non-profit organization in America. So the questions for you, what I understand that you need immunosuppression medicine for when we transplant the organ. But why we need immunosuppression medicine for tissue transplant?
Yes, because either just like organs, even the tissues have antigens, and the main problem is that it is the antigen antibody reaction between the donor and the recipient, because our body is made in such a way that we are uh, uh, trained to identify the foreign antigens and act against them. So when we are transplanting a tissue, it comes with a lot of antigens. And in a VCA or a vascularized composite allotransplant, there are different types of tissues. So there will be different forms of antigens. So the antigenicity of tissues is actually more than organs.
Wonderful, very great explanation. Now, continue with these things. So when we do knee transplant, it is also tissue transplant. When we do skin grafting, is also tissue transplant. When we do plastic surgery, is also tissue transplant. Then why we don't need at that time?
Because in plastic surgery or in skin grafting or in reconstructive surgery, we are using tissues from your own body. So it is self tissue. So the
right, and how
in
yes,
in
yes.
in an organ transplant, or in this, it is an allogenic transplant. So it is tissue or organ from somebody else's body. So definitely the body of the recipient is not going to accept it directly without immunosuppression.
Okay.
So when we do especially knee transplant, right? So when we do take the allograft on a knee transplant, still we don't need it. And acellular dermis tissue transplant, we don't need also immunosuppression. That is correct.
No, so a cellular dermis is it is processed. So all the cells and the antigens are taken off. So that is non-reactive. And for
Right.
knee transplant, do you mean knee replacement?
Yes. Very
So
correct.
knee replacement is an implant procedure, right? So it does not involve
Right.
any tissue. So there is no
I
question of
see.
immunogenicity.
Thank you very much,
Wonderful.
Rotarian
Very
Deepan Shah.
good.
Thank you very much.
Yes.
And over to you. Sorry, I have broken the thing after vote of thanks, but I wanted some more this thing because he has joined. Over to you, Rotarian Ruby Agrawal.
Thank you so much. And we had even though we did not feel a lack of presentation, as the question and answer round was quite intensive, and we gained in a lot of information about hand transplantation. And wishing again a very happy birthday to Rotarian Hemlata Bandari, Rotarian Jaskaran Singh, and Rotarian Shriya Goyal on this day. And thank you so much, Dr. Nilesh Satbhai, for this session. Over to you, President Rotarian Ritika.
Thank you, Secretary Rotarian Ruby Agarwal. Thank you, Dr. Nilesh Satbhai, for such a detailed question and answer session. And as Secretary Rotarian Ruby said, we really did not miss the presentation because the information was well taken by everyone. Thank you very much, everyone, for attending, and I thereby adjourn the meetings. Thank you.